Good afternoon, everyone. Thank you so much for joining this webinar hosted by the California Policy Lab at UCLA on predicting and preventing homelessness in Los Angeles. I think we have hundreds of people registered for this webinar from different organizations and from cities and states across the United States. And we're just so thrilled that you decided to spend an hour with us this afternoon learning about this project. Thank you. As a land grant institution, the California Policy Lab at UCLA acknowledges the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar in the Los Angeles Basin and the Southern Channel Islands. And I just realized that I neglected to introduce myself. I am Janie Roundtree. I'm the executive director of the California Policy Lab at UCLA. Just a couple of quick logistical notes before we get started. First of all, this webinar is being recorded, and we will send out a link to the recording early next week. We will also send out a link to the slides presented today, so please rest assured that we'll make them available to you. If you have questions throughout the webinar, please feel free to put them into the Q&A, and someone will try to answer them if we can and as soon as possible. We have a terrific lineup today of people that you'll hear from. In addition to myself, you'll hear from Brian Blackwell, who is the senior data scientist at the California Policy Lab, Dana Vanderford, who is the associate director of the Homelessness Prevention Unit, Courtney Goucher, outreach program manager for the Homelessness Prevention Unit, Claire Battis, the lead data program manager for the Homelessness Prevention Unit, and Max Stevens, who is Chief Analytics Officer with the LA County Chief Information Office and is available today to answer any questions that you might have around the data sources for the project and the history of integrating data in Los Angeles. So I want to start by talking about Ricky Brown, who is featured here with his grandson, Zion. In 2023, Ricky received a phone call from the Los Angeles Department of Health Services Homelessness Prevention Unit checking in on him. It was a cold call out of nowhere, and he would have been asked how he was doing. Someone would have acknowledged that it had been a tough year for a lot of Los Angeles residents, and Ricky was offered immediate financial assistance for things like groceries or gas, with an option to enroll in a program for longer-term support. Ricky received this phone call because he was predicted by our research team at UCLA as being at very high risk of future homelessness. You're going to hear more about Ricky and his family later in the webinar, but first we're going to explain how it came to be that Ricky got this phone call, what the research and predictive modeling entails, and how we came to work on this project together with the Los Angeles County Department of Health Services. There are a lot of different organizations and people who've made this work possible. In addition to the California Policy Lab, which provides the research and evaluation for this, we work closely with DHS, which I've already mentioned, which created the Homelessness Prevention Unit. That unit is supported also by the LA County Department of Mental Health and the the CEO, Chief Information Officer. So this work would not have been possible without contributions by Max Stevens, Andy Perry, and their colleagues over many, many years to integrate different county departments' data into something called the Information Hub, which is really a key ingredient for all of the work that you're going to see here today. In addition, this project has been funded almost the entire life cycle by the Conrad and Hilton Foundation that really helped us innovate and test something that was completely new. And frankly, their support is just crucial. CPL's research is also funded by the University of California and the Irvine Foundation. And finally, I just really want to shout out to CPL's Community Advisory Board, many of whom I think are registered for the webinar today. These are people with lived experience of homelessness or prevention programs or frontline workers, and they offered crucial input and advice both to the research and the actual design of the Homelessness Prevention Unit. So thank you all for your time and expertise. The California Policy Lab is a nonpartisan research institute. Our mission is to generate research insights for government impact. We do this by forming long-term multi-project research partnerships with public agencies here in California. And the UCLA site focuses our homelessness work primarily in Los Angeles County. A lot of what we do is unlock insights from data, either data from an agency's own data sources, but more importantly, linking data across different departments. And all of this is designed to produce evidence-based solutions for public policy problems. We work across 6 policy areas, one of which is homelessness, and that's what we're going to focus on today. So we want to start by offering some policy background and motivation for our research. And throughout the deck, we're going to share client quotes from the Homelessness Prevention Unit, and I'll read them mostly for accessibility reasons. In this case, the quote says that HPU came in a time of crisis when I didn't expect help. So why invest in homelessness prevention? Well, I'll make the case here in Los Angeles, at least. In our most recent year, the county reported that they were able to house across the system over 25,000 individuals. That's an enormous number of people who achieved housing in a single year. We're housing people, more people than we ever have. But it's impossible to keep pace with inflow. To put this in perspective, the increase in our point in time count, which counts people experiencing homelessness, is 43% from 2018 to 2024. And in our most recent point in time count, the survey revealed that 68% of people are reporting their first experience of homelessness. So inflow is constant, it occurs every year, and it's really hard to keep pace, which means that we have to not just house people, but prevent homelessness from occurring before it happens. What do we know about the pathways into homelessness and what might work as prevention? Our colleagues at the University of California, San Francisco Benioff Center conducted a statewide survey of people experiencing homelessness, and majority of people who were asked said that a one-time payment of $5,000 to $10,000 would have completely resolved a financial crisis and avoided them becoming homeless. So this is a signal that short-term cash assistance can work. We also know from the same survey that pathways into homelessness are different across people, and specifically, only 32% of people who were experiencing homelessness reported entering homelessness from a leaseholder or other situation from which they could have been evicted. The remainder, 68%, were entering homelessness from an informal living arrangement, sometimes called couch surfing or doubled up, or 19% were exiting an institution, primarily jail, prison, or a drug treatment facility. So the reason why this matters is that eviction prevention for homelessness prevention is essential. You have to have it to reach this 32% of people who are leaseholders, but you also need it to prevent people upstream from becoming homeless. But this also tells you that eviction prevention alone is not sufficient. You have to have prevention programs or a program model that's more flexible that can provide financial assistance to people who are not in a leaseholder situation. What do we know about the research or evidence behind prevention? Simply, it seems to work. There is a growing number of really rigorous causal impact studies to support the idea that rapid one-time cash assistance can prevent homelessness. Most recently, there was a rigorous study on the Santa Clara County prevention model in 2023. It showed that short-term cash assistance can reduce homelessness among adults. That study also showed, though, something that we've known for a while, which is prevention is really hard to target. If you're a public funder of homelessness prevention, a big concern you might have is, how do I know that this cash assistance or this scarce resource is going to people who would become homeless without it? To go back to that Santa Clara study for a second, it was a randomized control trial with a treatment group and control group. And the treatment group who got support, only 1% of those people ended up become homeless. So that's a great outcome. But if you look at the comparison group, none of whom got any assistance, only 4% of those people became homeless. So that shows you that the program is having impact, but also that it's very hard to target. Here in Los Angeles, we have millions of people enrolled in public benefits, but only a very small percentage of them are ever going to enroll in homeless services. So the California Policy Lab, we felt like this was a really ripe project or question for predictive modeling. And we wanted to test whether AI solutions or predictive modeling could help with this targeting. How do we know who's really at high risk? So for the rest of the presentation, we're going to focus on some key questions, and I'll hand it over to Brian Blackwell. First, we're going to ask, does the predictive model that we built identify people at high risk? Are we actually solving this targeting problem? Is the model equitable? Who is the model identifying as having a high risk of homelessness? What service model would be needed to outreach to and serve those individuals? What are the results so far? And then finally, what's our approach to evaluating the impact of the program? And with that, I'm going to turn it over to Brian.
Thank you so much, Janie. I'm going to give you a brief overview of how we built the predictive model and how it's able to identify people at high risk of homelessness. Just to clarify what I mean by predictive modeling, it refers to the use of statistical methods to discover patterns and relationships in data that can be used to predict future outcomes like homelessness. Sometimes this is referred to as predictive analytics or machine learning or artificial intelligence. So they're different terms which refer to the same thing. I'm not going to get too much into the weeds in today's presentation, but if you're interested in some more technical detail, it's covered in the technical appendix of the report that we released recently. Next slide, please. We're very lucky at CPL to have a partnership with the LA County Chief Information Office where we receive a fully anonymized, de-identified copy of an individual level linked administrative data set called the Information Hub, which contains over 10 years of administrative data records from LA County agencies. Through a process called feature engineering, we transform these data elements into numerical variables or features, which can be used as input to the predictive model. Now, because homelessness is something that affects pretty much every aspect of people's lives, we try to use as much of the available data as possible when building the model. So, for example, we have health system data on hospitalizations and diagnosis codes. We have data on mental health crisis stabilizations. We have data on people's histories of enrollment in benefits programs like CalFresh or CalWorks. We have data on arrests and jail bookings, and we also have data on people's prior histories of homelessness. So after applying the feature engineering algorithm to these data elements, the end result is 580 numerical variables that are used as input to the predictive model. And again, the technical details of this process are laid out in full in the report, but the key takeaway here is that we've built the model to use as much information as possible in order to make accurate predictions of risk. Next slide, please. So once you've figured out the data sources, the next step in building a predictive model is to identify the population where you're predicting risk and what is the outcome that you're trying to predict. Because HPU is a unit within the LA County Department of Health Services, our prediction population consists of about 100,000 people who use county health services each year. And among these 100,000 people, about 7% will go on to experience homelessness over the next 18 months. So when we're building the predictive model, we're interested in whether or not the model can identify a group that is at higher risk that we can refer to the HPU. Next slide, please. So we can see on this slide that the predictive model is in fact able to identify a high-risk list of 10,000 people each year. And about a quarter of people on the high-risk list go on to experience homelessness, which represents a 3.5 times improvement on random guessing. So this gives us some assurance that the model is allocating resources more efficiently by identifying a group in higher need of prevention services. I should just clarify that 10,000 number, it's not an objective statement about who is at risk of homelessness in LA County. It's really a number that's determined by the capacity of the program. So we refer about 10,000 people each year in order to meet the HBU's annual enrollment goals. For example, if the county were to expand the program, then that number could potentially be increased. And likewise, if HPU were to improve outreach contact rates, then we could potentially refer a smaller list. So it's really driven by program capacity plus a few other factors. And if you're interested in the formula for deriving that 10,000 number, it's provided in the technical appendix of the report. Next slide, please. As well as assessing how the predictive model identifies a high-risk group, it's also important to evaluate whether the model is equitable in the way it makes predictions. So the previous slides showed how a predictive model can help target resources more efficiently, but the use of predictive models raises a lot of legitimate questions about equity, racial bias, and fairness. And this is a challenging area because there are many different ways in which equity and fairness can be measured. And it's also important to take into account the social context in which the model is being deployed. So as I'm sure you're all aware, homelessness is a highly racialized phenomenon, with Black Angelenos making up about 10% of the LA County population, but 30% of people experiencing homelessness, according to the latest point in time count. So a key policy goal of homelessness prevention is to address these disparities by helping people at high risk of homelessness avoid that outcome. And the HPU is expanding the reach of county resources to people who are historically underserved, which could help address some of these long-standing racial disparities. Now, having said that, the predictive model has to be monitored for fairness and equity so that new biases are not unintentionally introduced. So to evaluate equity, we took a commonly used approach of focusing on the errors made by the predictive model, specifically false negatives. A false negative means that someone who would have gone on to experience homelessness missed out on being identified by the predictive model. Now, even though all predictive models make errors, that's just a fact of life, we want to make sure that these errors don't systematically discriminate against particular groups. So in our equity analysis, we see similar false negative rates across race, ethnicity, and gender groups. So there is no evidence that the model introduces inequities in identifying individuals who are at high risk of homelessness. The one statistically significant difference is that the false negative rate for Black individuals is actually slightly lower than for other groups, which means that the model does a slightly better job of identifying risk for Black individuals. This may reflect the fact that Black people are at significantly higher risk of experiencing homelessness due to discrimination and systematic racism in the housing and labor market and in the criminal legal system. And we decided in partnership with HPU that this difference didn't warrant making any adjustments to the model because we didn't want to take any explicit steps to reduce the number of Black individuals selected for HPU for the reasons of that social context, which I spoke of earlier. Next slide. So on the next couple of slides, I'll describe how this combination of predictive modeling and proactive outreach means that the HPU serves a unique group of participants when compared with other prevention programs. Next slide. So you'll recall that Janie talked about how existing prevention programs require people to self-identify as being at risk of homelessness. Right, so this slide really illustrates how HPU's proactive approach is very different and reaches a new and underserved population. We did an analysis which compares the HPU high-risk list with people enrolled in existing prevention programs in LA County and found that there was essentially no overlap between these two groups. I think this really underscores an important opportunity for predictive modeling that's often overlooked, namely that it allows you to reach populations who wouldn't otherwise have access to important services. Next slide. Another important fact about HPU's participants is that they have much more intensive service needs by comparison with participants in other prevention programs. This goes for the risk list identified by the predictive model, as well as people who are successfully contacted on that risk list and actually go on to enroll in the program. So they're more likely to have prior diagnoses associated with mortality on the Charlson and Elixhauser comorbidity indices. They're more likely to have prior diagnoses of serious mental illness, more likely to have diagnoses related to substance use, more likely to have prior contact with the criminal legal system. So it's important to bear in mind that these differences can be explained at least partially by the nature of the data that's being used in the predictive model that I talked about earlier. So we're not necessarily identifying generalizable risk factors for homelessness, but nonetheless, this analysis does underscore how HPU is different from existing prevention programs in terms of the participants that it's identifying. So I think this is a great moment to hand it over to Dana Vanderford, Associate Director of the HPU, to talk about HPU's service model.
Thank you, Brian, and thank you for having us here today. My name is Dana Vanderford. I lead the Homelessness Prevention Unit efforts here at the county's Department of Health Services under the Housing for Health umbrella. I too am going to share some client quotes today. This one that we'll share here, I think, really illustrates the circumstances under which we often meet our clients when we first pick up the phone and make that call. This client shared that they sat there thinking, who's going to help me now? And then a case manager called about a week later, and she helped me so much. We'll talk more about this in our presentation, but we do seem to find our clients at moments of real crisis in their lives. And we're able to appear virtually out of nowhere and hopefully provide assistance that that person desperately needs at that time to help them stabilize in their housing. I also want to return to tell you a little bit more about Ricky Brown. I think the story of this family is an excellent case study in what our program does, how we find our clients, and what those. Oh, I'm so sorry. Can you all see me?
No, could you turn your camera on? Sorry, Dina.
I believe it is on.
I can see you.
Yeah, I can too.
Okay, great. Sorry, Sean. I'll keep on going if most can see me. To return back to the Brown family, this is a photo of Ricky Brown and one of our HPU case managers, Fred, in their apartment in South LA. When we first met Ricky Brown, he had just assumed custody of his three grandchildren, all under the age of 15. They were all living in a one-bedroom apartment in South LA. They had recently become disconnected to their CalFresh and CalWorks benefits. So their income was placing the family in a dire housing situation. We were able to assist Ricky and his family with reconnecting to benefits, including retroactive pay for benefits that they had lost over the last several months. We assisted with car repairs, and we said goodbye to the family. They were still living in that one-bedroom apartment when we discharged the family from our program, but I'm really pleased to report that we recently heard back from the Brown family. And they have attached to a Section 8 voucher that's going to allow them to move into a 2 or 3 bedroom apartment in northern Los Angeles County, which will provide a lot more room for the family. And although that's not a resource that we directly connected that family to, I do think that it is an outcome that we want to celebrate here, that really demonstrates the agency that we hopefully help to instill back in the Brown family to help navigate complicated systems even after the family discharge from the HPU. Next slide, please, Jeannie. Thank you. I want to talk a little bit first about how we move from clients identified on the high risk list all the way to clients enrolling in our program. So as Janie and Brian mentioned, the list identifies eligible folks for our program who have a demonstrated high level of risk of losing their housing in the next 12 months. That list is sent to the HPU, where our data team re-identifies those clients, works through county administrative data systems to piece together client histories, client contact information, does a little bit of additional eligibility screening at that point, largely to determine if this individual or family is already experiencing homelessness and would therefore not be a good fit for a prevention program. Once a client moves through data mining, they are randomly selected into our treatment or control group. So we mentioned this, but the HPU is under evaluation. And so we are randomly selecting clients into our treatment group or a control group. At that point, if a client is in our treatment group, they move into the proactive outreach phase of our program. And Courtney on my team will talk about that in just a moment. If we're able to get in touch with a client, they're interested in enrolling in the program, they then move into program enrollment and beyond. So I'm going to pass it to Courtney now to highlight our unique approach to identifying and finding our clients.
Hi, y'all. My name is Courtney, and I'm the HPU Outreach program manager. And so I'm going to talk a little bit about our outreach efforts from 2022 and 23, and then go a little bit into our results after having a full outreach team dedicated to outreach in 2024. So what we're looking at here is a study group of folks that were outreached to in May of 2022 until October of 2023. And so what typically happens when folks get to our front door is we send out outreach letters, and in the letter, it usually has general information about our program and how folks can reach out to us directly if they have any questions or if they're interested. And then after that letter is sent out, we conduct a series of phone calls. So 3 phone calls made to each available number for our clients, and then over the course of 3 weeks. And then after, of the folks that we're not able to reach from the phone calls, we send out emails to any available email that the client may have on file. And then after that, of the folks that we're not able to reach, we then conduct collateral contact outreach. And so what this is reaching out to any DMH or non-DMH provider identified for the client as having been in contact with that client within at least 5 months. So we'll usually send emails to an identified point of contact if it's a DMH provider, or we'll call the public facing number for a non-DMH provider in hopes of reaching the individual that was in most recent contact with the client. And so although about 15% of our enrolled clients are from collateral outreach, we do find that when we're able to reach our clients through collateral outreach, our services have proven to be very beneficial. One of our clients who we recently enrolled through collateral outreach explained that he was getting our calls, he was receiving our messages, but there was just too much going on in his personal life for him to follow up. So we do like to continue collateral outreach, and it's just a great opportunity for us to communicate with other providers and share what we do. So as you can see in this study period, about a little over 2,000 folks were outreached to, and about 1 in 5 of those folks enrolled, 16% of those being single adults and 29% of those being families. And so we do see that singles do enroll at a lower rate, and overall contactability is the biggest issue when it comes to reaching our folks. Either we have numbers that just aren't are non-working numbers for our clients, or our clients just don't pick up because they don't know who we are, which is totally understandable. Something that we decided that could be a little bit helpful and beneficial in increasing our enrollment rates is having a team dedicated specifically to outreach. So 2024 was the first year that we had a full team of 4 dedicated to outreach for the HPU. And we did see our enrollment numbers increase. Singles went from 16% to 35%, and our families population went from 29% to 47%. Still seeing that trend, though, of families enrolling at a higher rate. So while we continue to see that contactability is one of our biggest challenges in reaching our clients, of the folks that do enroll, we are able to provide really effective intervention efforts. So I'll pass it back to Dana to talk a little bit more about that.
Thank you, Courtney. So excited to share now a little bit more about our program model and what happens when our clients move past the outreach and enrollment period. If a client says yes to enrolling in our program, they are assigned to a case manager for 4 to 6 months. We've got 10 case managers dedicated to serving single adults and 10 dedicated to serving families. All of our services are provided in-house. So although we work with partner agencies in the CBO space, their case management, HPU client case management is provided in-house. The intervention that our clients receive is sort of covers 2 parts. One being very, very flexible financial assistance to cover whatever the client immediately needs to stabilize in their housing. So, of course, we assist our clients with rental assistance with arrears, utility payments, bills that they might have, but we also pay for some things, feel lucky to be able to pay for some things that other programs may not be able to. So we'll pay off our clients' credit cards, we'll help them fix their vehicles, we'll buy them a new vehicle if transportation needs are present in the household. We really let our clients drive the spending of their financial assistance. And on average, our clients receive about $6,500 in rental assistance over that 4 to 6 month period. The other part of our intervention is linkages to supportive services. So our clients are high utilizers of county services and systems already. We want to make sure that they're well held by systems of care beyond their time with the program. So we want to connect our clients to mental health providers, primary care physicians, legal services, employment services, immigration services, whatever their needs are, we make warm handoffs to those systems of care, so that our clients' housing is not only immediately stabilized, but that their health is improved overall in the long term. Our primary goal, though, is, of course, to assist clients with maintaining safe and stable housing independently by the time they leave our short but intensive program. So the way we find our clients is unique. The way we outreach to our clients is unique. We also think that some of the ways that we have built our program for both our client experience and our staff experience is unique. So it's critical for us that our program is accessible to the clients that we are proactively outreaching to. We are low barrier from a documentation perspective. We can serve non-leaseholders, clients and families who are doubled up, because we believe that that's reflective of many people's experiences here in LA County. We built an HPU-specific family definition that allows for clients to really articulate to us who makes up their household, and then we try as a program to serve that entire household and preserve that household's housing stability. Our program is client-centered, so again, our financial assistance is extremely flexible. Our housing and services plans are really driven by our clients and made and executed in collaboration with our case managers on the team. We keep our caseload sizes very low, so each of our case managers works with around 15 clients at any given time. We believe that that allows our case managers to provide really tailored, responsive case management services to our clients who are highly acute and really need that attention for that case management relationship to be successful. We build in a lot of support staff here at the HPU, so our case managers are not doing this work alone. We have outreach specialists and a growing outreach team dedicated to doing full-time outreach and getting those clients through the front door. We've got a linkage program manager and a housing navigator on our team who plug in to support case managers in making those hard-to-make connections to supportive services and to find those scarce housing resources for our clients who do need to move. Staff retention is something we're extremely proud of. We thank the Hilton Foundation for their investment in the HPU. Those private dollars help us fund staff professional development, team building, bonuses for team members. We really think that the quality of case management depends on case managers sticking around and being a consistent force in clients' lives. And so we're very proud of our staff retention here at the HPU. And finally, I want to return to equity and emphasize that we monitor equity at every selection stage of our program. So we want to make sure that the same folks that appear on our outreach list make it through enrollment, make it all the way through discharge. So we are monitoring demographic data at each of those points to ensure that nobody is falling out of our services at any given time. And I'm going to pass it to Claire Battis on my team to talk more about that demographic data.
Hi, I'm Claire. I'm the lead data program manager at the HPU, and I'll get into our participant demographics and give a bird's eye view of what our enrolled population looks like. On the left, you can see we are much more likely to enroll female clients. And between that May 2022 to October 2023 study period, 64% of clients who enrolled were female out of a sample of 472. So the HPU serves both families and single adults, and we also find that the heads of households on our family side are more likely to be female as well. 43% of our clients identify as Black, 35% as Hispanic or Latino. As Brian mentioned earlier, we are measuring our race and ethnicity against point in time count data to ensure that as a prevention program, we are working upstream to serve folks who we see disproportionately represented among the populations affected by homelessness in Los Angeles County. Our program overwhelmingly serves people between the ages of 25 and 54. In the early days, we thought we would see more of an older adult population, but we have largely seen our enrolled clients living in that middle age range. And the reason you might not see any clients under 25 is by design. Our risk list excludes anyone under that age. Our program is just not best structured to serve transitional age youth at this time. However, many clients on our family side do have youth in their household, and our case managers work with the entire household and family as a whole towards housing stabilization. And not shown here, but the largest geographic concentration of our participants comes from Service Planning Area 6, which serves South Los Angeles. And this is about 25% of our enrolled population. Our program is still in evaluation, so we don't know, we don't have intermediate or long-term outcomes just yet, but we have some immediate outcomes that we'd like to share and we consider big wins to celebrate here. Although our participants are very challenging to enroll in the first place, once we get them in the program, we're proud to share that 92% of them complete the program all the way through to their planned discharge. Given the levels of risk and barriers our clients face, we think it's pretty remarkable such a large proportion stick with the program and receive the full menu of services and support available to them. About only 5% we lose contact with over those 4 to 6 months, and another 3% withdraw or may leave the program early for other reasons. I think it's a testament to the excellent work of our case managers and support staff in our unit that clients want to stay and are able to stay through the life of the program. Finally, 86% of clients retained what we consider long-term permanent housing at the time of their discharge. We'll look at more long-term data on housing retention and other indicators of client health post-discharge. But even this as an immediate outcome, we still feel it's a really high percentage of clients who retain permanent housing when we say goodbye, especially when we often find these clients just 4 to 6 months earlier in, as Dana said before, times of real crisis, often facing eviction, just left the hospital, just lost their job. Not all of our clients do retain housing in the program or time of exit, and that's also a testament to the efficacy of the model in predicting people who are likely to lose housing. So just considering the timing and the situation surrounding when we find folks, for 86% of them to retain permanent housing is pretty incredible to us. For us to assist in resolving those crises and keeping them housed through the life of the program and hopefully beyond is something we're very proud of. And I'll hand it back to Janie to talk more about the evaluation and looking ahead.
Thanks so much, Claire. So I'll just share a final client quote. That's our main goal, to make sure they're able to take care of themselves after we're done. Apologies, that's a quote from a case manager, not a participant. So I'm going to talk very briefly about our evaluation strategy. I want to give the county a lot of credit for agreeing to do a causal impact study, where we are detecting the effect of the HPU by comparing the HPU participant outcomes to a group of people who have the exact same level of risk and circumstances. And so by structuring the evaluation as a comparison between these two groups, we can really isolate the effect of the program itself, and not any external factors that might be affecting participants. So we're able to do this because the program capacity is smaller than the demand, which means that we're able to randomize people into the pool of people who will be referred to HPU. And we're randomizing from the risk list. So that's basically a randomized control trial, which is the gold standard for detecting impacts. We began the randomized control trial in February of 2023, and based on current enrollment rates, we'll be able to analyze the program's outcomes in 2027. So this slide just shows you the evaluation design and maps the research questions on. So Brian mentioned that there's this high risk list that where people are referred to HPU. We randomize people into outreach and enrollment or not. And so the first research question is, what is the effect of outreach and enrollment into the Homelessness Prevention Unit on homelessness among participants? We're also running a secondary study where once participants are enrolled in HPU, they're randomly assigned to either a smaller amount of financial assistance, $4,000 to $8,000, or a larger amount of $6,000 to $10,000. So the research question there is, what's the effect of expanded financial assistance? So again, around 2027, we're hoping to provide results to these two separate research questions. And happy to answer questions about the evaluation in the Q&A. So we're going to end the formal portion of the webinar by showing a short 2.5-minute video featuring HPU participant Brianna Alvarez, who is here on the left, and case manager Jocelyn Bataz on the right. And then after that, we'll open it up for any Q&A. So I'm just going to stop sharing briefly, and then I'm going to reshare the video. So if you could just bear with me for 1 second, I will do that.
So we're gonna go do a client visit with my client Brianna at the park. We're just gonna catch up with her, see how she's doing, see if she's completed any referrals, if she needs help with anything, and just an overall check-in.
My name is Brianna Alvarez, and I live in Oneka, California. We were going through an eviction, and I was going through a lot of mental health problems. So we decided to, when I got the brochure in the mail, I decided to call, and that's how I got services. I had lost my job around March. We had lost a baby as well at the same time. So we already had housing, but my landlord was trying to illegally evict us for unpaid rent that was an illegal rent increase. So they linked me with Housing Rights Center, and Housing Rights Center helped me fight the eviction.
My name is Dana Vanderford. I am the Associate Director of Homelessness Prevention with the county's Department of Health Services. We often reach our clients in moments of crisis. So a client will have just exited the hospital, or they've just lost a job, or they've received a verbal warning of eviction from their landlord. We think the financial assistance will help in the short term. We'll assist our clients in resolving immediate crises that they might be facing, but we think the linkages to supportive services are what really will help our clients sustain their housing long term and improve their overall health.
So my caseworker, her name's Jocelyn. She's a really lovely lady. We've grown to have like a good relationship throughout the last 6 months. I got help with housing stabilization. I got help linking to mental health services, as well as other resources to things that I felt like me and my husband and family needed at that time. You guys are amazing. No. I'm not gonna lie. You guys are... So I finished my high school diploma. I will be crossing stage in May after I deliver. I'm really excited about that because I also have other things planned for the future, as far as like getting my nursing degree and moving forward in that field. And I also feel confident as not only a tenant, but knowing that I'm gonna get that financial coaching to be able to make the right decisions in the future for my family. So the eviction is now over. He had to cancel the eviction in order to move through with the process of Housing Rights Center. And along the way, I also learned my rights as a tenant and what he is supposed to do as a landlord and what he's not supposed to do as a landlord. And so now we're, in stable housing again, still at the same place, but now I know how to stand up for myself. Even if you don't see results immediately, in the long run, it's definitely way better than just ignoring the letter in the mail. They're really here to help us and to help anyone in need.
So thank you so much to Brianna and Jocelyn for sharing their stories. And I think at this point, we're open to taking questions for the last few minutes of the webinar. Thank you.
We are. Thank you. This one, I think we'll start with Max. There's been a lot of questions from people who are interested in replicating the program, specifically questions about the data needed to do something like this. And if you had any advice for other cities or nonprofits that might be interested in doing an approach similar to the HPU. Max, if you want to start, and Dana and Janie and anybody else want to weigh in. And just a reminder to unmute yourself.
There we go. Thank you. Yeah, I mean, obviously, we are trying to make it easier to share information nowadays because, sort of data-driven operations seems to be kind of, growing in its interest and in it just its sort of the extent to which agencies are wanting to move in a data sharing direction. It does take a very long time, even with kind of, all of what we've learned over the last 10 years to arrange for the kind of data sharing that we have here. So I mean, I guess my first sort of piece of advice in this is sort of, ask yourself what your time window is and understand that probably getting the kind of data sharing agreement that you need to do what we're doing with Janie's with CPL and with Janie's staff and with Dana, you're looking at about probably about a year to execute an agreement. It's not a reason not to do it, but it's just it's important to understand going into it that you can't just sort of snap your fingers and enter into a data sharing agreement with that sort of is going to involve whatever 10, 12 agencies that are in our integrated data system. So, talk to us about this if you are interested in it, and we can kind of walk you through what that's going to entail and sort of the kind of deliberations that have to happen on our end. But we certainly would like to see more of this kind of thing in the future, and hopefully, if we're able to do that, we can also kind of create some kind of a more expedited way to get the data sharing piece in place. I would just throw it over to Janie, I guess, or whomever else would like to speak to this.
Well, I think I'll just only add that the data environment in Los Angeles is really unique. The data that we use for the project is discussed in detail in the report, but it's coming from a number of different county departments, including inpatient, outpatient visits, mental health services, prior histories of homelessness, child welfare, although we didn't use child welfare data for this particular project. And it's really just remarkable what Max and his team has achieved in terms of the county's own internal data sharing and in engineering of data for this. So a lot of people ask us how to get started in other places, and I don't want to give the impression that you need all of that data to do research, right? So we're hoping other counties or cities or states try this and maybe try it with different kinds of data sources so that we can learn a little bit more about what's required. But I did just want to give credit to the county and Max in particular for many years of work investing in that.
Thank you. Courtney, I think this next question might be for you. One of the questions is the primary enrollment challenge related to inability to make the initial contact or not having up-to-date contact information, or is it that you're making the contact but getting low follow-up or enrollment from there?
Yeah, I would say that the main issue would be contacting the clients. A lot of the contact information that we do have is just not updated. So we're finding that we're leaving, voicemails, or the voicemail is not for the client. So I would just say inability to contact from just not being able to reach the client.
The only thing I would add on there is that we have a pretty high level of success when we can get somebody on the phone. So Courtney's team has a script that we individualize per team member. If a client picks up the phone, we can almost always get them to a yes. So it is really an issue of being able to make contact in the first place.
Thank you. We also had a fair number of questions about the number of people age 55 and older that are enrolled in HPU or outreach to. Some people were a little surprised that it wasn't a higher share. I don't know if anybody would like to weigh in on that.
Yeah, I can weigh in. So it's absolutely true that as a group, older adults are increasingly experiencing homelessness. But it is also worth bearing in mind that in the most recent point in time count, 63% of the population experiencing homelessness in the point in time count was aged between 25 and 54. Right. So that demographic breakdown for HPU is actually not that far off what we're seeing in the PID count. Not sure if anyone else wants to chime in here.
Thank you, Brian. Oh, sorry, Jenny, go ahead.
No, go ahead.
The next question, there's been a few questions about just costs in terms of kind of the technology and the statistical software side of it, and then also more of the program management side. So if you guys were able to give like a general idea on that.
I can say a little bit about the statistical side. So it's worth bearing in mind that this is fairly traditional predictive modeling. We're not talking ChatGPT style generative AI here. Our secure data hub at CPL consists of a few servers. The overall technical infrastructure at CPL for building the models is really not that much more than you would find in your household. Although I would say that the actual data that we rely on from the LA County Chief Information Office for the Information Hub, is a really important, piece of data infrastructure. It's a data warehouse that's used for many, many purposes in Los Angeles County and is a really critical piece of infrastructure. But yeah, this is not, in terms of model training, it's not taking up huge amounts of cloud computing resources or anything like that. Maybe I'll
Yeah,
sorry, go
Brian,
on, Jen.
I'll just add before we turn it over to talk about program costs that the UCLA does provide the research and the model to the county for free. And we're able to do that because the Hilton Foundation made an investment in our research and innovation. I would say the cost here is really around people time. The science here is maybe the easiest part. It was just the collaboration to figure out how to deploy the model inside a health services setting and all of the conversations that entailed across a pretty diverse group of people, everyone from people who lived experience of homelessness to program managers to the scientists working collaboratively over time. So that tends to be a more hidden cost, but something that was both enjoyable and resource intensive. And now I'll hand it over to Dana to talk about the program.
Thanks, Jeannie. Yeah, I just want to say first that the HPU was going to start as sort of a small and mighty and innovative approach to providing targeted prevention resources. So we began with an investment of $1.5 million in local funds through Measure H and $1.5 million in Hilton grant funds. That was going to allow us to run, a staff of 7 and serve a smaller number of clients and really study outcomes for those clients. We received a significant investment of federal American Rescue Plan Act funds in July of 2021 that has allowed us to sustain for the last several years. Our program costs are sort of divided 50-50 between staffing costs and client financial assistance. And I just will say on the staffing side, as I mentioned earlier, we have a significant amount of support staff built in and we keep our caseloads relatively low. So I just want to acknowledge that we are a staffing heavy program, but we're also a 4-month program that is serving a highly acute population of folks who were trying to keep in their housing rather than enter the homeless services system at all. So we may not be the leanest program, but we think that from a cost benefit perspective, the funds that we spend on our staffing and that we provide to our clients, we believe are, preventing folks from entering into a very expensive system of care and a cycle of trauma. I would not have done it any other way than the funding combination that we had. And again, we're grateful to our local funders and to the board and to the Hilton Foundation for what they've allowed us to do here.
Thank you, Dana. You touched on this a little bit, but we've got a lot of questions about scaling this up. So there's questions about could this be applied to other programs in Los Angeles? If you had an unlimited budget, what would that look like? Maybe you could talk a little bit about kind of how you were able to scale up from that small pilot to that larger program and if there were any lessons learned.
Yeah. I think the first person that we hired when we knew we were going to bring more case managers on, we now have 20 case managers on the team, was our housing navigator, who is a miracle worker. We realized that because we are working with a group of folks with such a high level of risk that we were going to naturally have folks who needed to move, that we were going to be meeting folks on day one who were going to lose their housing in a matter of weeks, and that we would need somebody to help us navigate market rent housing and affordable housing in LA County. And so our first hire was for a housing navigator. And from there, we grew out our family side of our program. So one of the best parts about scaling was that we were a program originally designed to serve single adults. Scaling allowed us to serve families as well. Um, I guess Claire, Courtney, anything you'd add on the scaling side that feels like a lesson learned?
And just also, I wanted to shout out to Courtney's team who does the outreach. I think that was one of the biggest changes we've seen in terms of the data and our enrollment rates. The case managers already have to provide such intensive services within such a short time frame, and doing outreach to their own clients on top of that was just very difficult. So once we hired and scaled up and got a team that was just dedicated to cold calling and getting people through the door, we saw such a great turnaround in being able to actually successfully contact and enroll people.
Can I just say one more thing there? I really could not emphasize more that the more folks in the homeless services and housing space take care of frontline workers and direct service providers, I think the better outcomes we'll see for folks who are in need of those services. So it is one of our top priorities to not only make this a pretty singular experience for clients who are in our care, but also for members of our team who have worked in this space for a long time. We want to take care of those folks. We want to keep them on this team. And so staff retention and sort of team health and culture has been something we've heavily prioritized and invested in.
Thank you, Jana. I think we'll close on this last question. Jana, we've had a number of questions about if I wanted to start a program, what are the first three things I should kind of start thinking about? So if you want to answer that.
Sure. For the combination of predicting homelessness and preventing homelessness, I would say first, there are some minimum data requirements. So you need data to observe people who are experiencing homelessness, and you need some data on potential risk factors that will help you do the prediction. And that data needs to be regularly updated or refreshed in a way that you could use it to inform program enrollment. And then second, you need an implementation partner or a use case. And you really have to start with both of those things at the very beginning, because the way that your model will be used affects actually your engineering and design of the model itself. These two things are very interrelated and collaborative. So in our case, it was really important to identify the DHS as the partner that would use the model, and they gave us a lot of requirements for what the model needed to do. And then a sense of who your model is going to identify as being at high risk and what those people might need. We're learning a lot about prevention. We certainly do not have answers to all of the questions. So I really hope people will go out and innovate and test the impact of these different program designs. This one in particular was designed for people who are very vulnerable, and as you saw, more vulnerable than people enrolled in typical homelessness prevention programs. But you could see any number of models selecting for clients who have different needs. So an understanding of how to tailor your intervention to your potential client base. And then, of course, we hope that all of these things are rigorously studied so that we can all learn from them and scale and adopt different solutions to preventing homelessness.
Would anybody else like to add to that? Okay, I think we are at about time. As Janie mentioned at the top, we will be emailing out a recording of the webinar that we did today, as well as the slides and the report, probably early next week. So we really appreciate all of the many good questions and everybody attending today. So thank you so much.
Take care. Thanks.